I'm Dr. Ethan Carter, and I want to ask you something important. What if the biggest threat to your health isn't something that arrives suddenly, but something that's been quietly growing inside your body for months, or even years, without causing obvious pain? Every year, thousands of people are diagnosed with colon cancer only after it has reached an advanced stage. The heartbreaking reality is that many of them notice small warning signs, but dismiss them as simple digestive problems, stress, or just getting older. The good news is that your body often gives you clues long before the disease becomes life-threatening. In today's video, I'm going to share 9 early warning signs of colon cancer that you should never ignore, especially if you're over the age of 50. These signs don't automatically mean you have cancer, but recognizing them early and speaking with your healthcare provider can make a life-changing difference. Stay with me until the end, because some of the most important warning signs are the ones people overlook the most. Colon cancer develops in the large intestine, also known as the colon, and in many cases it begins as small growths called polyps. These polyps may not cause any symptoms at first, which is why colon cancer has earned a reputation as a silent disease. Over time, however, some polyps can become cancerous. The encouraging news is that when colon cancer is detected early, treatment is often much more effective. That's exactly why understanding your body's warning signs is so important. This video isn't meant to frighten you. It's meant to help you recognize when something doesn't feel right so you can seek medical advice without delay. One of the earliest changes many people notice is a persistent difference in their normal bowel habits. Perhaps you've always had a regular routine, but suddenly you're dealing with constipation that lasts much longer than usual. Or maybe you find yourself rushing to the bathroom several times a day because of ongoing diarrhea. Some people experience both, switching back and forth without understanding why. It's easy to blame these changes on stress, diet, or aging, and in many cases those explanations are correct. However, if the change continues for several weeks and doesn't return to normal, it deserves attention. A tumor growing inside the colon can sometimes affect how waste moves through the intestine, leading to noticeable changes in bowel movements. The important thing isn't that you had one bad day. It's whether your body continues behaving differently from what is normal for you. Another warning sign that should never be ignored is blood in the stool. This can appear as bright red blood on the toilet paper or in the toilet bowl, but it can also be much darker, making the stool look almost black. While blood can be caused by less serious conditions such as hemorrhoids or small tears around the anus, it should never be assumed that this is the cause without proper medical evaluation. Sometimes the bleeding is so slight that it can't be seen with the naked eye, yet it continues slowly over time. Hidden blood loss can eventually lead to other health problems, including anemia and persistent fatigue. That's why any unexplained bleeding should always be discussed with a healthcare professional, even if it happens only once. Many people also describe a strange feeling that their bowel never completely empties. They use the bathroom, stand up, and within a few minutes feel as though they need to go again. This sensation can become frustrating because no matter how many times they try, the feeling doesn't disappear. Although constipation and other digestive conditions can cause similar symptoms, a growth inside the colon may also create this constant feeling of incomplete emptying. Because this symptom isn't usually painful, many people ignore it for months. Unfortunately, waiting too long allows potential problems to become more serious. Paying attention to changes like this gives you the opportunity to investigate the cause before it progresses. Persistent abdominal discomfort is another symptom that often goes unnoticed. Everyone experiences stomach pain occasionally after eating too much or trying unfamiliar foods. That's perfectly normal. What isn't normal is pain or cramping that keeps returning week after week without an obvious explanation. Some people describe the discomfort as a dull ache, while others experience pressure, bloating, or repeated cramps in the lower abdomen. These symptoms don't automatically mean cancer, but they shouldn't be accepted as a normal part of getting older either. If abdominal pain becomes persistent, interferes with your daily life, or gradually becomes more frequent, it's important to have it evaluated rather than hoping it will disappear on its own. Unexpected weight loss can also be an early warning sign that deserves attention. Imagine stepping onto the scale and discovering you've lost several pounds, even though you haven't changed your eating habits or exercise routine. At first, some people are pleased by the number going down, but unexplained weight loss is never something to ignore. There are many possible causes, including thyroid disorders, diabetes, digestive diseases, and certain cancers. When your body begins losing weight without any clear reason, it's sending a message that something may not be functioning properly. Instead of celebrating unexplained weight loss, it's much wiser to find out why it's happening. Understanding the cause early gives you the best chance of treating whatever is responsible. At this point, you may recognize one or even two of these symptoms in yourself or someone you love. That doesn't mean colon cancer is the cause. In fact, many common digestive conditions can produce very similar symptoms. The purpose of this video isn't to encourage self-diagnosis. It's to remind you that persistent, unusual, or worsening symptoms should never be ignored. Your body communicates with you every single day, and learning to listen to those signals could protect your future health. In the next part, I'll reveal the remaining warning signs, including one symptom that many people mistakenly blame on aging, along with the simple steps that could help detect colon cancer before it becomes life-threatening. One of the warning signs that many people overlook is constant fatigue. We all feel tired from time to time, especially after a busy week or a poor night's sleep. But this type of tiredness is different. Imagine waking up after a full night's rest and still feeling completely drained before your day has even begun. Some people find themselves struggling to concentrate, while others feel exhausted after doing simple tasks that never used to be a problem. In certain cases, colon cancer can cause slow internal bleeding that isn't visible. Over time, this hidden blood loss may lead to iron deficiency anemia, reducing the amount of oxygen carried throughout the body. As a result, you may feel weak, short of breath, dizzy, or constantly fatigued. If you've been unusually tired for several weeks and can't explain why, it's worth discussing with your healthcare provider rather than assuming it's simply part of getting older. Another early warning sign is stool that becomes noticeably thinner than usual. Most people never pay attention to the shape of their stool, but changes can sometimes provide important clues about what's happening inside the colon. If the stool repeatedly appears pencil thin or much narrower than normal over several weeks, it shouldn't be ignored. A growth inside the colon may partially block the passage of waste, causing this change in appearance. Although, other digestive conditions can also cause narrow stools. A persistent change deserves medical evaluation. Paying attention to these small details may seem uncomfortable, but they can sometimes provide valuable information about your health before more serious symptoms appear. Another symptom people frequently dismiss is persistent bloating or excessive gas. Many foods naturally cause gas, and occasional bloating is completely normal. However, if your stomach feels swollen almost every day, or you constantly experience pressure and discomfort that doesn't improve with dietary changes, your body may be trying to tell you something. Some people notice that their abdomen feels unusually full even after eating only a small meal. Others experience frequent gas accompanied by cramping or discomfort. While these symptoms often result from harmless digestive issues, they should never be ignored when they continue for weeks or gradually become worse. The key isn't experiencing bloating once or twice. It's recognizing when the problem becomes persistent and different from your normal digestive pattern. Another warning sign is persistent nausea or a reduced appetite. Have you ever looked at your favorite meal and suddenly realized you weren't interested in eating? Perhaps you feel full after only a few bites or frequently experience mild nausea without a clear explanation. While temporary appetite changes can happen during illness or stressful periods, long-lasting changes deserve attention. If a person consistently loses interest in food, feels full unusually quickly, or experiences unexplained nausea for several weeks, it's important to identify the underlying cause. There are many possible medical explanations, and one of them can include problems affecting the colon. Ignoring ongoing appetite changes may delay diagnosis and treatment of conditions that are much easier to manage when detected early. The ninth warning sign is one that many people mistakenly ignore because it develops slowly over time. It's simply the feeling that something isn't right with your body. Perhaps your digestion has changed, your energy isn't what it used to be, you've noticed occasional bleeding, or you've lost weight without trying. Individually, each symptom might seem small, but when several of them begin appearing together, your body is asking for attention. Too often, people convince themselves that everything will eventually improve on its own. Unfortunately, waiting can allow serious conditions to progress. Listening to your body's signals doesn't mean assuming the worst. It means giving yourself the opportunity to investigate problems while they're still easier to treat. The most important message I want you to remember today is that having one or even several of these symptoms does not automatically mean you have colon cancer. Many common digestive conditions, including hemorrhoids, irritable bowel syndrome, infections, and inflammatory bowel diseases, can produce similar symptoms. That's exactly why guessing isn't enough. Only proper medical evaluation, appropriate testing, and professional advice can determine the true cause. The purpose of this video is awareness, not fear. Early recognition gives you choices, and early action can save lives. If you're over the age of 50, or even younger if you have a strong family history of colon cancer, inflammatory bowel disease, or other risk factors, talk with your healthcare provider about whether screening is appropriate for you. Colon cancer screening has helped save countless lives because it can identify precancerous polyps before they become cancer. In many cases, removing these polyps prevents cancer from developing altogether. That's one of the most powerful tools modern medicine has for protecting long-term health. There are also simple lifestyle habits that may help support colon health. Eating more fiber-rich foods such as vegetables, fruits, whole grains, and beans, staying physically active, maintaining a healthy weight, limiting processed meats, avoiding tobacco, and reducing excessive alcohol consumption are all associated with better overall digestive health. These habits don't guarantee prevention, but they contribute to lowering the risk of many chronic diseases while improving your overall well-being. Remember, your body often whispers before it screams. Small, persistent changes deserve attention because they may be the earliest opportunity to identify a problem while it's still highly treatable. Never ignore symptoms that continue, worsen, or feel unusual for you. Seeking medical advice isn't a sign of fear. It's a sign of taking control of your health. Thank you for watching. If you found this video helpful, share it with someone you care about. It could encourage a friend or family member to recognize an important warning sign and seek medical advice at the right time. Don't forget to like this video, subscribe to the channel, and turn on not.